Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens. We're taking your calls right here, right now, 866-870-5752. And right now we're speaking with Lola in Los Angeles.
Lola, I wanted to say a couple more things. By the way, it's Dr. Marc Darrow, and we're talking about stem cells and platelet therapy. But Nola asked about osteoporosis, which is losing bone mineral density. And I just wanted to mention something about it. We don't pay a lot of attention to that other than give these terrible medicines that actually cause fractures. That's right, folks. I know it sounds crazy, but that's the pharmaceutical industry. Big selling drugs that hurt people. It's all over the place. One of the things that people don't realize is osteoporosis is generally what we'll call a disease of the elderly. You know, as you get older, you lose your hormones. You lose your bone mineral density with that because the bones stop remodeling. And 1/3 of people who fracture their hip who are elderly, I'm not sure what elderly means anymore, but I'd say probably 60, 65 today. 1/3 of those people die from a hip fracture because of osteoporosis. That's a huge amount of death. And it's so easy to remodel the bones and grow back the bone mineral density using hormones. It's just that it's not standard care of medicine yet. It will be someday. Medicine's slow. It's very slow in changing, very rigid. And there was a study done in 2002 called the Women's Health Initiative, and it showed erroneously that estrogen causes breast cancer. Years later, that study was taken apart, the statistics were redone, and now people think differently. But doctors still don't want to give estrogen to women. Go figure. That's the way medicine goes. So Lola, thank you so much for coming in. I understand you just said at the end of our conversation you actually came into my office sometime with your mother. And what was it your mom came in for? I don't remember you guys. Lola's flew the coop.
Lola, are you there?
Yeah, I'm here.
Oh.
Can you hear me?
No.
You can't hear me?
No, I can barely hear you. But why did your mom come into my office?
It was quite a while ago, and at that time it was for prolotherapy.
Okay. So we're talking about 15, 20 years ago.
Yeah.
Yeah.
Mm-hmm.
Okay. How's your mom doing? She's still with us?
No, but
Okay.
the treatment served her well. And,
Okay.
right, she deceased about 3 years ago.
Okay. Well, God bless you, and God bless your mom and your family. So I just wanted to say that because you mentioned that she came in many years ago, and I helped her. What part of her body did I work on?
It was they were like kind of around the spine area.
Okay.
For the sciatica.
Okay. So that would be the iliolumbar ligaments and most likely in the quadratus lumborum muscle at the lower back and the thoraco-dorsa fascia that attach on the pelvis. And back in the day when your mom came in, we used sugar water mixed with lidocaine. And people go, what do you mean sugar water? And it's actually a very good treatment. There's a doctor in Florida who still does it. It's not very well known anymore. And he loves doing it, but his technique is I don't know what the right word to use. It's very invasive. So while he's doing the sugar water, he is chopping up the tissue a little bit. You might say a lot of, I'll call it dry needling with the needle as the solution's going in. So one thing that happens is we traumatize tissue. there are cells called fibroblasts that are sequestered or brought to the area to help regrow the tissue. And that's the technique he uses. It's an old style. Today we don't do that as much. He's one of the few guys that still does it. Today we use platelets from the blood. Very simple. We just draw the blood and spin it, and then take the platelets out and inject those. Very much more powerful than dextrose. And then for those people that have something that they want to heal even better, we will add stem cells to that. So it's all really prolotherapy, even the newer stuff, even the stem cells, because what prolotherapy comes from is proliferate, or proliferative therapy. So we're proliferating new tissue and regenerating the area. Lola, God bless you, and thank you so much for calling in. You've helped people understand so much about what all this process is with regenerative medicine using stem cells and platelets. And I just want to thank you so much.
Thank you, Lola.
You're quite welcome. Thank you so much. Bye-bye.
All right.
Bye.
So I'm going to give out the phone number for the rest of you that want to call in. And the phone number to talk to me live right now is 866-870-5752. I'm going to repeat it while you write it down. It's 866-870-5752. If you want to call the office and get information directly there. And by the way, calling either of these numbers, you will get a free book that I wrote. It took me 5 years to put all this research together. It's a very dense book on regenerative medicine of stem cells and platelets. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And there are over 250 scientific studies. The book is a couple hundred pages long. The studies are all about why you should not get orthopedic surgery, the problems that happen afterwards, and why you should get regenerative medicine, which is so simple. It's just walking in the office, getting injections, and walking out. It's a very, very conservative type of a treatment. Surgery is a very invasive type of a treatment. And for those of you that know me, you know that when I was in medical school, I had a shoulder surgery, and it ruined my shoulder. And I was very upset because I was on the path to doing orthopedic surgery. I was in on tons of surgeries. I would call orthopedic surgeons all over the city and ask them if I could come into surgeries with them, and they were very gracious, and I would be in surgery all the time when I had free time, when I wasn't in medical school. And I was all jacked up about it until I had the surgery. And I had about a 4-year period after that surgery where my right arm was pretty useless. It was all swollen. I had a fever after the surgery. And it wasn't until I learned about regenerative medicine and as an experiment injected my own shoulder and woke up the very next morning pain-free with full range of motion. And that was a shocker for me. At that point, I started begging my patients to let me try this on them. And most of them said, please do, I don't want a surgery. I'll try anything without surgery. And then it became the mainstay of what I did in my life, and I've been doing it now for over 25 years.
That's amazing.
With amazing, amazing success. And the thing that's amazing about it is I love doing it. Most people get better. I know, Nita, you're breathing. That means we have 3 callers waiting, so
That's
we'll get to
right.
that. Janice, Dr. Marc Darrow, you live in La Crescenta, and your husband has a knee that's bothering him. How long has his knee bothered him for?
Janice, are you there?
Oh, I'm sorry. Hello.
Hello. How long has your husband's knee bothered him for?
Well, in 2015, he was going for knee replacement surgery, but once he got in there, he turned out he had a temperature and he had come down with some kind of infection, so he never got it. And now we're in 2023. But my first question is, do you treat people who are 91 years old?
Yes.
Or is that exclusive?
Yes, it's common that I treat people in their 90s.
Something about this, and it said you can't be under a certain age or over a certain age to be treated with stem cell surgery.
Okay. So, well, first of all, the stem cell is not really like a surgery. It's very simple to do.
Well, I know that, but stem cell injections, whatever word you want to use.
Okay, so I treat people 100 years old, and I've treated kids who are early teenage. So you're going to read a lot of what I'm going to call, excuse me, Nita, BS on the internet. And I find these treatments work on
PRP on his knee about, what was that, a year ago, Richard?
Okay.
Probably around a year ago.
Okay.
And because he has a blood condition, his platelets clump. So you have to take it out really quick and spin it immediately.
Well, that's not a problem.
They didn't do it fast enough, so he ended up with 6 blood draws before they finally got it right.
Okay.
And then I don't know if that had anything to do with it, but he didn't seem to get much of a relief from that.
Okay, I'm going to ask you a question, Janice. If you've got a hole in your backyard and a mound of dirt, how many shovelfuls does it take to fill up the hole?
I don't know. It depends on how big your shovel is.
Yeah, it depends. One PRP treatment is not magical. Just like one stem cell treatment is not magical. There's nothing magical about these treatments. All they do is they stimulate tissue to grow. So there's several reasons for failure of regenerative medicine of platelets and stem cells. One is the person was too active after they had the treatment. That's the most common reason for failure. Number 2, they can be taking anti-inflammatory medicine, which blocks the inflammation that's needed for healing. That's things like ibuprofen.
Right, I know. Okay.
Number 3, they didn't get enough treatments. Okay, I always tell people, and I make them sign something that says there's no guarantees and you may need more treatments. And number 4, they got a bad doctor. A bad doctor is a guy who doesn't know what he's doing, or a nurse, or whatever it is. And then number 5, a doctor who's not using an ultrasound to guide the needle. Do you remember, Richard, if an ultrasound was used to guide the needle into your knee?
Oh, Richard. Oh, no, they did not use it. I was there. They did not use it.
Well, then how do they know where that needle is going? How do they know where the PRP was going? They don't.
Okay. Well, what about the stem cells for an older person who has...
Yeah, I do it all the time. Do it all the time.
Lung disease,
age,
heart disease.
I'm going to say it again. Janice, age has nothing to do with this.
Okay.
I'm sorry that what you read on the internet, there's a lot of junk knowledge out there. There's a lot of people that don't do much of this that write about it, or quote scientists who write about it. You know, I don't have a lot of regard for scientists. I don't have a lot of regard for doctors. I'm just sorry. I don't. I are one, but
yeah, I was going to say you are one.
I are one, but I like to think outside the box. And what I find is people who are very mental don't have a good grasp on healing. You know, you've got to have good street sense to help people, not read it out of a book or read an article or a research study or any of that stuff, which I'm going to call nonsense to me. And I really
now
tick
let me
off.
ask you another question
sure.
about stem cells. We've been looking into this for forever, waiting for this moment that we could get his knee fixed. So, and my only source of information is the doctors that he does go to or has gone to, and the books. That's it. So, one of the things he's been told by his orthopedist, who specializes in knees, is that you can't use stem cells for knees yet because they could go to your heart or anywhere, and they migrate. That's my husband says that's the word he used.
Well, you know what? I'm gonna say this in a very funny way. That would be the best possible thing that could happen. It doesn't happen, but it'd be the best possible thing that could happen. And your guy, you know, God bless him, doesn't know what he's talking about. I'm sorry. Okay. But stem cells have been used for years to heal hearts after heart attacks.
Well, I mean, I have a girlfriend who's alive today because of stem cells, so I know it's wonderful. Stem cells are wonderful, but I'm just putting out there all the negatives so that I could...
Well, it's not a negative. It's not a negative. It's people that don't know what they're talking about. Just because you go to a doctor doesn't mean that doctor knows anything. I'm sorry. And what I tell people in any field, in the stem cell field or any field, kidneys, hearts, you name it, go to the doctor who does the most. not a doctor who doesn't know about it or does a
Okay.
little bit. You got to go to someone. I do regenerative medicine all day long. I've been doing it all day long for 25 years. I rarely ever take a vacation. I love what I do. And I think I probably have done more of this than anybody on the planet. So I have some credibility in what I'm telling you from experience, not from what I read. I read all kinds of stuff on this, and it's balderdash. It's from people that don't know what they're talking about.
Okay. Well, I will enjoy reading your book.
All right.
How do I get the book?
We're going to give you a call, get your address, and send it out to you.
Okay.
We got you covered.
It's
honey.
encouraging, and he needs to exercise. If you saw him, you would guess his age to be about 70, maybe. No one, every doctor, every person he meets just thinks you're kidding me, right? But he's just a rare bird, and he's aged very slowly. He does have a hearing problem. That's why I'm talking.
Okay.
And he's listening.
Good. Anyway, I'm happy to help him out. The phone number to the office, if you want to make an appointment, is 800-300-9300. That's 800-300-9300. And if you want to read about this and watch videos of me doing these procedures, go to my website, www.jointrehab.com, www.jointrehab.com. I've got all the information there that you need. It's real information. It's not the nonsense science of it. It's the real stuff based on 25 plus years of my experience.
Okay. Well, thank you very much. I appreciate it.
Yeah. And I have a problem with a lot of people because I tell them I don't believe in science, and they go, "You're a doctor, you're a scientist." And I go, "I am, but I'm also practical, and I've got pretty good street smarts about healing because I've been doing this for so long and I've done so many cases. I watch how it works. It doesn't make me better or smarter than anybody else. I just have a lot of experience in it."
Sounds good. Would you like to talk to Roger?
Roger, Dr. Marc Darrow, how are you?
I'm fine, doctor. I guess age is just catching up with me. I've come down with a problem was diagnosed as severe carpal tunnel on both hands simultaneously, which is sort of astounding to me that both hands would fail like that at one time. And I was wondering, would stem cells be a candidate to help with carpal tunnel?
It's possible. I have to examine you. Just because someone told you have carpal tunnel doesn't make me believe you have carpal tunnel. And the fact that they both came up at the same time makes me wonder. It's possible. All things are possible. But you may just be inflamed right now. And it hasn't been going on that long.
My hands seem to be very inflamed for some reason. And I have spinal stenosis, and I just had an MRI done of my neck area because I have problems there.
Okay.
And I don't know if it's being generated from the neck or if it's just carpal tunnel that's causing the problem.
Okay. Now listen, you got to be really careful, Roger, because you said you had problems in your neck. Do you have neck pain?
Yes.
Okay. Don't let anybody operate on you because you have stenosis. All right? Stenosis doesn't cause neck pain.
Yeah, I've had this for quite a while. As a matter of fact, it's I have rheumatoid on top of everything else.
There you go. So that's what I was looking for.
Yeah,
the rheumatoid arthritis is probably just inflamed your wrists and is impinging on the nerve right now. I wouldn't get a surgery for carpal tunnel on that.
Okay, so I guess what
I got to examine you. Unfortunately, I can't do this over the radio and do you justice. So I would say...
Would it be helpful to bring any X-rays or MRIs that I have?
Yeah, bring it with. I don't diagnose based on that, but you can bring it with, sure. It's always good to have as much information. But write this down, 800-300-9300, that's the office number.
We've
800.
I'm going to, yeah, can we call now?
Yeah, call the office right now. There's people there. And then also you can go to the website at www.jointrehab.com, jointrehab.com, and you can watch me doing these injections, these videos of me, and see if it's something that you think you want. I think I can help you. And another thing that we're going to do with you, we're going to change your diet. Roger, we're going to change your diet because you sound like you're just inflamed right now. And if you have rheumatoid arthritis, the way to get rid of it temporarily, it's not going to fix it.
If you could help me on some of that, I'd really appreciate it because the rheumatoid, I've had it since my 20s.
Okay.
So, and I thought that was awfully unusual to have it.
Okay.
But it does run in my family.
Okay. You should look up on Google right now, alkaline diet. And that'll help it'll help quell down the inflammation in your body. And I wouldn't be surprised if the carpal tunnel went away if you really do the diet. You can't cheat.
Okay.
You got to be committed. You got to be so sick of this that you're willing to change.
Yes, definitely. Anything to be around longer for my wife.
Or I'll kill him.
Exactly.
That's funny.
God bless you guys. Thanks for both of you calling in.
Thanks for your call.
Been good talking to you. So Sheila, Dr. Marc Darrow, you've got osteoporosis or questions about it? Tell me about it.
Yes, I'm pretty severe, and I was listening to the previous caller, but I've had a couple of years of 4KO and then grew a bunch of bones back in, but then got on Actimel afterwards and started losing bone again. And I don't have, I've done enormous labs a couple of weeks ago, and I'm not deficient anywhere at all, in hormones or anything. So I just can't maintain bone. I can't keep I have all the classic over 50 female, postmenopausal. It's in my family. Eating disorder for 10 years, decades ago. You name it. Yeah, I fill all the boxes. And I'm short and lightweight, and I can't keep bone in when I get it. Okay, so I'm going to challenge what you said, not challenge you, just what you said, because it's what you were told by a doctor. You do not have normal hormones, okay? Okay. It's impossible. I've never seen it one time. Okay. I mean, look, anything's possible, but improbable. So just based on your age, by the time... we all start losing our hormones in our late 20s, and then the bones stop remodeling, and then we start losing bone mass. I'm not saying that you're in terrible problems, but how old are you, Sheila? I will be 62 next month, a month from yesterday. Okay.
So I'm just going to put it out the way I experience it. If you are willing to supplement your hormones, you will probably grow back a ton of bone mineral density and improve your osteoporosis.
So is there a name of the hormone? And we did 38 different blood tests.
There's 3 of them that I would most likely give you. I have to do a blood test first, unless you already have it. The 3 hormones would be testosterone, progesterone, and estrogen. Whoops, show is over. God bless you all. Thank you, Alex, Nita Valens, Suzette, and the crew. And I'm going to give out the phone number to my office now if you missed the show. It's 800-300-9300. There's people there to pick up phones. And the website where you can email me is www.jointrehab.com. God bless you all.
And listen to our pal Warren Eckstein, 11 to 1 every Saturday on The Pet Show. And we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.